afternoon, everyone. I'm Elizabeth Taylor. Today is April 16, 2016. I'm giving my informative speech on home health care. Is everyone familiar with home health care? Home health care is anyone needing assistance staying in their home, which may be medical work or companionship. Who can provide home care? Companions, family caregivers, homemakers, medical social workers, occupational therapists, physical therapists, RNs, or CNAs. I've gotten this information on Gale Virtual Reference Library through Tri-County Library webpage. There's no author, but the title is Aging and Disability Resource Center of Broward County, Florida. Who needs home care? Anyone needing assistance staying in their home. And I have a few printouts on 10 warning signs for a family or a loved one, or a friend who may need some assistance. A few warning signs would be changing eating habits, eating loss, weight loss, neglecting personal hygiene, not bathing, neglecting the home, not doing laundry, sweeping, cleaning up the dishes. Inappropriate behavior would be paranoid, quiet, or loud. Relationship patterns, physical injuries, which would be bruising, burns, forgetfulness resulting in unopened mail, bills not being paid, unusual purchases. And also I have a chart for America's aging population. It's the estimate of the growing age population. By 2020, the aging population will grow to 17%. And I have gotten that through Gale Virtual Reference Library, Tri-County Library webpage. The author would be Aston Gary. New twist on services with the older patient in mind. How to choose in-home care. There's a few things to look for when choosing in-home care. Are they licensed and certified? You have to be a licensed in-home care provider to provide services. That would be meeting DHEC requirements. Are the agency certified through Medicaid and Medicare and or Joint Commission? Does the agency provide confirmation or proof of malpractice and liability insurance? Ability to provide services. Does the agency provide? What services do the agency provide? Does the agency service in the area in which you live? Will the agency provide written description of services to be provided? Quality of services, how long they have been in the area. Cost, what are the total costs of services you require? Are they covered through insurance, Medicaid, Medicare, long-term care policies? How much of the services will be covered by your insurance? Is there a copay? Agency, staffing, and training. Does the agency require verified employee reference? What are the employees' qualifications for their specific job descriptions? I have gotten this information through Gale Virtual Reference Library, Tri-County Tech College Library webpage. The article will be Aging and Disability Resource Center of Broward County, Florida. Services home care may include professional nursing care services, which will be in-home assessment, medication and pain management, diabetic care, orthopedic care, rehabilitative care, personal services, which will be bathing, dressing, medication reminders, mobility assistance, transferring and positioning, incontinent care, toileting, in-home companionship and care services, which would be respite if they had a family caregiver or a friend caring for them. They would provide respite care for them for a break. grocery shopping, meal prep if they are not able to cook for themselves, like housekeeping, laundry, also medication reminders, errands and services if they are not able to transport themselves to and from, medical appointments, grocery shopping, grooming, dressing guidance, mail assistance and organization. Also, if they provide 24-hour care, living care, if they need more assistance staying in their home, and if they can't be left alone by themselves, if they're high-risk fall, they could be cancer patients, COPD, dementia. If they have dementia, they could wander off at any time. And I've gotten this information through the Gale Virtual Library, Tri-County Tech Library webpage. The author would be Jerry Aston, New Twist on Services with the Older Patient in Mind. Does anyone have any questions?
I do. What types of medical issues would someone have that might need home health care?
I have a chart presented right here. That's through the Gale Virtual Reference Library, Tri-County Tech Library webpage. Let's see. The author would be Jerry Aston, New Twist on Services with the Older Patient in Mind. There are different medical issues someone may have to have in-home care, which would be cancer, COPD, dementia, diabetes, fractures, heart disease, kidney disease, pneumonia, stroke, urinary tract infection. Is there any other questions? No? Well, thank you all for coming.